Chain Drug Review and Mass Market Retailers Video Forum. Brought to you by the Emerson Group.
Hello everyone, I'm Jeffrey Wolt, Editor-in-Chief of Retail Media IQ. Welcome to our video forum. Today we're going to bring you a preview of an event that's getting quite a bit of buzz in the industry, and that's the Nourishing Change Conference, which will be held in Cincinnati beginning on May 13th. To talk to us about what people can expect, we have two guests today. One is Jim Kirby, Chief Commercial Officer at Kroger Health, and also Holly Freishtat, Senior Director of Feeding Change at the Milken Institute. Jim, let me begin with you, since Kroger really is the driving force behind this event. What's the purpose of it, and what made you feel that it was needed today?
This is an event for the industry. It's a time in history that I think it's more important forever that people come together and focus on their commonalities to create change and kind of set the competition aside. So we wanted to bring together retailers in the industry together. And I'm not even talking about grocers. I'm not even just talking about pharmacies. I'm talking about retailers in general to discuss what a new model of care could look like, where we place patients at the center, leverage all of the good that retailers do, but also connecting to the broader healthcare ecosystem with nonprofits, with academia, with the traditional healthcare ecosystem and payers, because we all have a part in this transformation. So this was our time to convene and to create the change that I think our country, our communities, and most importantly, our patients are in so desperate need.
Holly, let me turn to you and ask, why is this needed at this point? Why is the concept of food as medicine so necessary to promote to the industry and to consumers as well?
So this is a trend, and really it's turned into a movement. We have been having these conversations. I mean, this is not a new concept. I mean, those who've been in the field for a while, it's been a good 20 years, right? But what we've seen now is that now it's not just pilots, supported off one-off projects. We've had some great innovations and philanthropists, supporting this. We are now seeing, really coming out of COVID-19 5 years ago now, we have seen that we need to reassess and redefine what improved health outcomes look like and what is the role of food in doing so. And that has all been disrupted. And so with that disruption, we're seeing great innovation. And this innovation is coming and making sure healthcare is accessible, and our grocery store can provide that platform, or food retailers can. And these coordination and collaboration with healthcare, health insurance, food retailers, and also all the companies and technology systems that we need to be able to make this happen. And I think it's taken so long to get to this place because we needed to have that moment of that technology and those systems that we now have and these other opportunities that we have not been able to access that we do have now. So it's a really exciting time because we can now see how we can make healthcare and food care integrated in our neighborhoods so it's really convenient and really easy.
Jim, you mentioned the need to collaborate, the desire to collaborate. How would you assess where we are today in terms of getting other retailers involved, getting the food supplier community involved? How much work is ahead of us to make this vision a reality?
There's just a lot of good that's going on, but there's still a lot of change that needs to happen. We're seeing a shift in traditional healthcare where there's a greater focus on proactive care, a focus on holistic care and social determinants of health, but we're not really seeing, I would say, the acceleration or the speed in which that CMS or anybody hoped would take off with some of the models that they tested and are promoting and are incentivizing to happen. So this is our moment to kind of, as I said, set our competition aside and let's look at the top issues. Let's celebrate the wins that we've had and the good work, certainly. But I don't want this to be a convening where we're just, that's just it. We're just opining on our work or tapping each other on the back for the work. I want to really get real and address the things that haven't been done before. what gaps exist and how we can create maybe unlikely collaborations to address those gaps.
Holly is someone with a broad perspective on the market who does a lot of research. What do you hope will come out of this meeting in May?
So what I find really exciting is that we're bringing a lot of competitors together to work collaboratively because we know it needs to be done. And I was talking to someone a while ago, and they gave me a great analogy I really like to think about. This analogy that you build a foundation of the house, and that's where all the competitors and all our partners are. Then each of the rooms in the house will have a different color, right? And that's what we're really doing here. It's like all the competitors, all the different payers and insurance companies, all the retailers, all the different companies that are competing against each other are all coming together because we can all see what the future needs to hold, and we need to be doing it together. No ands, ifs, or buts, right? And so we are building that foundation right now. I think the foundation has been built. It needs to get a little bigger. It needs to get a little steadier, right? And that's what we're doing at this conference. And then it will make it easier to create, because the competition allows the patient to have choice. We want patient choice. We want the patient or the person to shop at the store that's best for them, and that they get, the foods that they need in the way they want to see it. And in order to do that, we need to see choice. And so I really see this convening at this scale. We have seen, to be honest, lots of food as medicine conferences. We've seen a lot of them recently, but they're small and they're narrowly focused. And what we're seeing here is a much larger perspective of food retail. And also I really admire and kind of thinking about how is retail health being redefined, and you're trying to do this on stage. And because if you go to Google retail health, say, it hasn't worked here, but it's because it needed to be reimagined and redesigned. And we needed to have new players and everyone thinking about it a little differently. And I think that Nourishing Change is really starting to tackle what that looks like and how to make retail health, incorporating food and have a really successful model and reimagining what it could be.
Jim, Holly mentions, reimagining retail health. How much more collaboration will that require between the pharmacist and the dietitian?
If you are an entity like Kroger or Hy-Vee or Giant or different entities that have dietitians, I think somewhat it's easier, but we still haven't even figured out how to crack that nut in as big a way as that we want. I mean, we have millions of patients that we're serving every year, and we have, if you think about half of them probably have some sort of chronic condition that could benefit from nutrition therapy. How do we get those patients in touch and to schedule an appointment and to keep their appointments with their dietitian and have it covered by their payer, their insurance plan or their employer, so that it's no out-of-pocket expense to them? So there is the physical act of how do you connect with through the pharmacy, the patient to the dietitian, but then there's also the billing and the claims processing and the documentation systems and how they all share. So there's a data and technology piece that has to be interoperable as well. So there is an advantage there if you have your own dietitians, but I would say that this is even broader than that. I would look at it as how does pharmacies in general, with the unparalleled access they have to their patients and communities, how do they assess and identify people with food and nutrition insecurity? How do they identify people that have transportation needs or housing needs and refer them, or mental health needs, and refer them to an entity that can help them, whether that be a digital therapeutic provider, whether that be a community-based organization in their backyard, whether it be a competitor. I think the most important thing is that the patient is getting care, and that we're following up to ensure that they're getting care and that care is achieving the intended outcome. And with that kind of thinking, if we're all aligned on that, that we're going to address the entirety of the person that's in front of us and all of their healthcare needs, then everything else becomes much easier. But there's still all of this work from data, infrastructure, provider relationships that need to happen, and of course aligned incentives from the payers all the way down.
And Holly, how attuned are patients and consumers, food shoppers, to the concept of food as medicine and to the services that are slowly emerging in the industry?
So I think that we're sitting at this unique juncture, right? If you look at the last couple of years and you look at when we define, and let me be clear, when I'm using the word food as medicine, because everyone's defining it differently and that is fine, but I want to just be clear on when I say the words what I mean. So when I'm talking about food as medicine, I'm talking about produce prescriptions, medically tailored meals, medically tailored groceries, right? And having that tied into your healthcare, whether you're being referred by a pharmacist or a dietitian or a doctor, right? But that it's built into part of managing your existing, illnesses or disease states that you may have, managing chronic disease, or looking at food as a role of prevention, right? There's a whole pathway. And so when you think about this work and this need, what we've seen nonprofits, and they're really essential to this role, and they've been going out into the community to find out who needs these services and to provide the food as part of food as medicine. But we've also seen that it's not reaching as many people as we need it to, and that there's been a lot of hard work to do this. But we need to meet people where they are, and they are at going to their pharmacies, at their grocery stores, right? And that we need to make it easy so that people can be able to know about these opportunities. And the pharmacist has that moment right now, and is able to provide and navigate that care. And when you think about these last several years, we've made great strides in providing, food as medicine, like the actual covering of food, whether it's 1115 waivers or whether it's through Medicare Advantage. But we have not yet made the strides we need on covering the care, right? And we released a report, supported by National Association of Chain Drugstores, NACDS, and that's where we started to work very closely with Kroger and many others on looking at what is the role of the pharmacist. How can they be, the care provider and providing food as medicine care? And it could be referring out for the different foods, or to the dietitian, to the front of the store, wherever it may be. But we need to be looking at that whole continuum of care related to food as medicine.
And our packaged food suppliers getting on board?
Yes, they're invited, and we're having a whole part of the conference. We're having a whole emerging brand competition, which there will be a panel of judges that will evaluate the products that they're bringing to the conference, and the winner gets benefit of some placement at Kroger. So we're trying to, again, address everything from the top of the food chain all the way down to the delivery of care.
Well, it's certainly going to be an exciting event, and I look forward to being there. One final question for you, Jim. How would people get involved if they would like to attend?
Well, it's really easy. You can go to nourishingchange.com, and you can see our full agenda. You can see the list of attendees and sponsors, and you can make plans to come to Cincinnati, Ohio on May 13th through 15th at the Hard Rock Casino and be part of the movement. And I do just want to underscore that last point, Jeff. Holly talked about, the foundation of the house. This is forming the foundation of the house, this one event, but this really is to be a movement, and there will be work groups, and there will be things that happen outside of the conference and ongoing throughout the year. And as we start to define what are those top issues that we need a deeper dive into, and it will be a cross-functional team on each of these work groups that will be reporting out their recommendations and the work that they're planning ahead.
Thank you both so much. I look forward to seeing you in Cincinnati in May.
Can't wait, Jeff. Thank you, Holly.
Appreciate it.
Thanks.